Hello and welcome. Today we're diving into the world of upper respiratory tract infections, or URTs. These common illnesses affect the nose, sinuses, pharynx, larynx, and sometimes even the trachea. We'll explore what causes them, how they affect your body, and what you can do to prevent and treat them. So, what causes these pesky URTs? The primary culprits are viruses. Rhinoviruses are the most common, responsible for the majority of common colds. But other viruses like coronaviruses, adenoviruses, respiratory syncytial virus or RSV, and influenza viruses can also lead to URTs. Bacteria, while less frequent, such as Streptococcus pyogenes or Group A strep, can cause infections like strep throat. Occasionally, fungal infections can also occur in immunocompromised individuals. Let's peek inside the body to understand how URTs work. When a virus or bacteria enters the upper respiratory tract, it attaches to the cells lining these areas. This triggers an immune response. The body releases inflammatory mediators such as cytokines, causing swelling, redness, and increased mucus production. This inflammation and mucus buildup lead to the familiar symptoms of a stuffy nose, sore throat, and cough. In some cases, the infection can spread to the sinuses, ears, or lower respiratory tract. URTs are incredibly common, affecting people of all ages worldwide. They are particularly prevalent during the colder months, likely due to increased indoor crowding and changes in humidity. Children are more susceptible than adults, as their immune systems are still developing and they haven't built up immunity to as many viruses. The common cold is a leading cause of doctor visits and missed days from school and work. The symptoms of URTs can vary depending on the specific infection, but some common signs include a runny or stuffy nose, sore throat, cough, sneezing, headache, low-grade fever, fatigue, and body aches. In more severe cases, you might experience ear pain, facial pain, or difficulty breathing. Symptoms usually last for a few days to a couple of weeks. Diagnosing URTs is usually done clinically based on symptoms and a physical examination. In many cases, no specific testing is needed. However, if a bacterial infection like strep throat is suspected, a throat swab can be performed for rapid strep testing. For severe or persistent infections, further testing, such as viral cultures or PCR testing, may be necessary to identify the specific causative agent. Imaging studies like RAYS or CT scans are rarely needed, but may be performed if complications such as pneumonia or sinusitis are suspected. While the term upper respiratory tract infection broadly covers many illnesses, understanding specific types can be helpful. Common examples include the common cold, characterized by mild symptoms like runny nose and cough, sinusitis involving inflammation of the sinuses, pharyngitis, or sore throat, tonsillitis affecting the tonsils, laryngitis, inflammation of the voice box causing hoarseness, and the flu, or influenza, which tends to more severe symptoms like fever, body aches, and fatigue. Treatment for URTIs primarily focuses on relieving symptoms. For viral infections, rest, fluids, and over-the-counter medications like pain relievers and decongestants are usually sufficient. Antibiotics are ineffective against viruses and should only be used for bacterial infections like strep throat, prescribed by a doctor. Home remedies like gargling with salt water, using a humidifier, and getting plenty of rest can also provide relief. In more severe cases, antiviral medications may be prescribed for specific infections like influenza. Prevention is key to reducing your risk of URTs. Frequent hand washing with soap and water is crucial. Avoid touching your face, especially your eyes, nose, and mouth. Cover your mouth and nose when you cough or sneeze, using a tissue or your elbow. Avoid close contact with people who are sick. Get vaccinated against influenza and, if available, COVID-19. Maintaining a healthy lifestyle through proper nutrition, exercise, and adequate sleep can also strengthen your immune system. The prognosis for most URTs is excellent, with most people recovering fully within a week or two. However, complications can occur, such as sinusitis, ear infections, pneumonia, or bronchitis, especially in young children, the elderly, or individuals with weakened immune systems. Recent research is focusing on developing new antiviral medications and vaccines to combat common respiratory viruses. Advances in rapid diagnostic testing are also helping to identify the causative agents of URTs more quickly, allowing for more targeted treatment.